My first postdoc was at Memorial Sloan Kettering Cancer Center. I realized during my graduate education, before I left for internship, that I had a specific interest in oncology. And at the time, the field of psycho-oncology was really just beginning. And so I elected to do a postdoc at Memorial Sloan Kettering Cancer Center. And there I trained with Dr. Bill Red and Dana Bovberg, and we were very much interested in the influence of stress and physiological reactivity in women that were either at risk for breast cancer or had a family history of breast cancer specifically.
And for a postdoctoral fellowship at the University of Michigan, 1 year in psychiatry, it was a behavioral medicine program in which I did more traditional smoking cessation, weight management, stress management, biofeedback. And that kind of took me to a career at Wayne State subsequently in 1991 and since, in which I've worked at the mind-body issue for about 2.5 decades now.
A year of postdoc at the University of Pittsburgh in the Pain Evaluation and Treatment Institute with Dennis Turk, also focused on pain.
Moving on to postdoc, where I went from not only working with these populations but being seen as more of an independent practitioner, and while being supervised and given guidance when necessary, being seen as the main psychologist on the team and being able to make those decisions, as opposed to feeling like you're still having your hand held as you would in training programs, but making that transition to being an independent practicing psychologist.
I went on to do a postdoc actually at the University of California, Berkeley in public health. And what drove me to make that shift was that I had been studying physical activity, smoking cessation, and dietary interventions for my graduate training, and I wanted to get more experience in alcohol prevention. That was the one area I hadn't learned much about the measures or those type of interventions, so I went to UC Berkeley to get that experience.